apart from being unsightly and thus affecting a patient's quality of life, varicose veins can be associated with some significant medical problems. The first of these is bleeding. The veins can either be damaged by some mild trauma or also because the skin overlying the veins becomes of poor quality. This can lead to some rather alarming bleeding, which may lead to you needing to go to an emergency department. Fortunately, the bleeding is relatively easily controlled by elevation and compression, but if you have had a bleed from a varicose vein, it's highly likely that this may recur. Secondly, the vein can become thrombosed or clotted off. This leads to inflammation around the vein, which looks very much like an infection. The area becomes hot, warm and tender and is often misdiagnosed as cellulitis. It is in fact a sterile inflammation and just needs anti-inflammatories and compression for it to settle down. The problem associated with thrombophlebitis is that if it is extensive, it is associated with a much higher risk of developing a DVT or deep venous thrombosis than someone who does not suffer from this. Finally, varicose veins can lead in the end stage to venous ulceration. About 3% of people who have varicose veins do go on to develop venous ulcers. This is because the varicose veins affects the quality of skin around the ankles, leading to even small trauma not being able to heal. Even with optimal management, the treatment of venous ulcer is protracted and may last for many months. Varicose veins occur because of failure of the valves in the affected veins. In the legs, blood moves from the feet up towards the heart, and in the veins there are small valves which stop the blood moving back down under the influence of gravity. In people with varicose veins, these small valves fail and the blood refluxes back down the veins, filling the tributaries. These become engorged, enlarged and tortuous, and these are the veins that people describe as varicose veins. The predominant reason for the development of varicose veins is hereditary, and it can also occur in pregnant women. The reason for this is due to the physiological changes that occur during pregnancy. In some cases, these veins resolve after pregnancy, but in others they remain. Obesity is also associated with varicose veins, as is occupations where people spend a long time standing still. The treatment of varicose veins has developed rapidly in the last 2 decades. Open surgery, although it still occurs, is very rarely indicated. The vast majority of treatments now involve closure of the saphenous or truncal veins instead of removing them. In most cases, this is undertaken using a heat ablation technique where the heat is delivered either by a laser or radio frequency. This is the first step of the treatment, which is to treat the underlying cause. The visible varicose veins that remain are either treated then by using injection sclerotherapy techniques or by removing them in a process called phlebectomy. The size of the veins affecting people who have varicose veins ranges widely. This starts with the large truncal veins, as previously discussed, right down to the very fine thread veins which are barely visible. The treatments of these do differ, with the large veins being treated with the endovenous thermal techniques, as previously discussed. As the veins get smaller, they can be treated by removing them using small incisions in a process called phlebectomy, or by treating them with injections where sclerosant is injected into them. As they become yet smaller, the injections become finer in a process called microsclerotherapy, and these very small veins can also be managed with a number of different techniques such as phototherapy.